there's a buzzword for every diagnosis. Don't forget that. There is a buzzword for every diagnosis, and you find them and you connect them. This is a bow tie question. And next is caring for a 75-year-old male. Okay. Client admitted for hip fracture. Right? Patient report history of what? Urinary urgency, frequency, dribbling, nocturia, and weak strain. Did anything buzz in your ear? If it doesn't, go back again and read it again. And next is caring for the 75-year-old male client admitted for hip fracture. I give you age, I give you sex. Hip fracture is a distractor. Patient report of what? Urinary urgency, number 1. Frequency, number 2. Dribbling, number 3. Nocturia, number 4. And weak strain. Those are history. But that's not why he was admitted. He was admitted for hip fracture. Well, he was receiving what? 100 ml of normal saline, probably preparing for surgery. The last time he voided was 7 hours ago. We have a problem, right? Test taking strategy. Connect the thing. 75, with all these symptoms, he's getting fluid. He has no pee for 7 hours. The straight catheterization was unsuccessful due to resistance twice. They tried to put a catheter in to get urine. They have resistance twice. Which condition the client is most likely experiencing, or 2 conditions should be taken and monitored. Test taking strategy, adapt and classify. When you see a bow tie question, this is critical situation. You don't come out with the action, or you don't monitor any action until you find the diagnosis. Find the diagnosis. It go like that. Number 1, you find the diagnosis. Once again, make the diagnosis, okay? And then take action. And out of those actions, you monitor them. That is your bow tie, right? Go to the middle, go to the left, and then you go to the right. That is the way to approach what? Bow tie question. Now, let's go to the meat of the question. 75. Urgency, frequency, dribbling, nocturia, and weak strain in a male is what? You be the judge. Let's go to the answers. Urinary tract infection. Do you think the board will give you a case like that? And I never even give you a fever. And they don't give you dysuria, that burning when you pee. Those are classic for urinary tract infection. I will have given you a white count. In a 75-year-old, probably I'll present it the way that the patient will have loss of consciousness or change in mental status for sepsis. They're not going to hide anything. They will give you the buzzword. They will not going to make used words, you know. They will create it in the buzzword form, but you have to pick that answer. It cannot be UTI the way I've written the statement. This is not a board question. I did it. Then somebody may change the language, but I just want to give you information that the board will give. It cannot be UTI. There's no way you have to pick you at UTI just because it cannot void. You cannot do that. So that one is gone. Nephrolithiasis. This cannot be what? Kidney stone. If it's kidney stone, I will tell you the word acute. There is no acute. I told you this is the history. He was admitted getting heavy fluid and then he has no pee for 7 hours. If I want you to worry about kidney stone, nephrolithiasis, I would have said acute onset of sharp stabbing, okay, excruciating pain down from the flank to the groin. Classic adapt and class buzzword to the groin. You don't see that. BPH. This is classic. Urgency, frequency, dribbling, Nocturia, weak stream. And what? Unsuccessful catheterization times 2. Something is wrong. Why no renal failure? I know he has no P. Yeah. Is he in renal failure? Possible. He can obstruct and have a renal failure. But there's no board question where they will give you renal failure. They have to give you two things. There is acute renal failure and there's a chronic renal failure. If it's acute, I will tell you something happened, patient cannot pee. At surgery, cannot pee. Has a heart attack, low blood pressure, and other problem. Or there's injury somewhere, obstruction somewhere, acutely. Chronic, I'll have to give you creatinine. So look at the flow. I keep on telling you guys to look at the first two sentences of the. If I give you a case, I have to put the buzzwords in the first two sentences, and I'll sprinkle the rest in it. The big ones will be in the first two sentences, and the rest will be sprinkled throughout. So we know it's BPH. Now, if you know BPH is easy to take care of, you have to go to the pathophysiology. You can't have surgery in acute situation. There's no transurethral resection of the prostate is the surgery for BPH. But in this situation, test taking strategy. They're going to trap you. You can't have surgery right away. We got to temporize you. So that's wrong. We'll give you this. Alphozocin is an alpha blocker, basically opening the prostatic urethra and allow flow of urine. So this is the medication. There's a bunch of them. They are flow mass, basically alpha blockers. Phenoxin paradigm. Okay, test taking strategy. This is not a pain issue. It's not a UTI. So you should not be trapped by that. Right? This go to the UTI. Dealing with UTI, and that help with dysuria. There's nothing in the question that tells you this is a dysuria problem. You got to put a Foley in. What kind of Foley? Coude. It's not the same kind of Foley. The Foley has a tip like that. It shapes some way, and it can maneuver through the opening of the no matter the size of the prostatic urethra, it will go through. So that's what we call Coude catheter. So that's what you use. After you put in those information, guess what? Thinking. Adapt and class provide content and test taking strategy. The color of the urine is what you're going to monitor. If I traumatize you, your urethra twice, trying to pass a catheter there, you're going to bleed. As soon as you put a Foley in, there will be blood. So check the color of the urine and monitor it. This was no kidney stone, so don't pick it. And I don't expect him to have acute UTI right away from obstruction. It's been going on. He has a history, buzzword. So that's good. And you monitor urine output. And I ask you, what is BPH? What are the signs and symptoms? What you'll be able to rattle it. What is nephrolithiasis? What are the signs and symptoms? What you should look for? And when they give me a case, what are the buzzwords I'm looking for? Then you master the content. Take care of yourself. Merry Christmas to you. Have a good day. Bye-bye.